I'd like to welcome everyone today to our fourth in this series for mental well-being. And today we have Dr. Watson presenting on depression and overcoming apathy and finding hope. And I'm sure that you'll all find this very helpful. Please enjoy.
Thank you so much. It's a pleasure to be back again. Thank you everyone who's joining and everyone who's watching this after. So we're going to dive into, it's a pretty heavy topic, talking about depression. But the thing to remember with depression is it always comes in a scale. So you will have some students, sadly, that are very, very depressed. You will also have students that are a little bit depressed or go through depressive stages or states. And it's a very normal brain reaction when we face hard things. So what we want to do today is give you some simple tools and strategies and language you can use to really support your students and other people that your colleagues, and also yourself if you find yourself in a bit of a depressive state. So these skills are really universal across the ages. So we'll start with just looking at what are the signs. This is the question that I often get asked by educators. How do I tell? How do I know if my student is struggling or my colleague is struggling, or even how do I know if I'm struggling? And how do I know if it's depression or when it tips over into something that's not helpful? And so the thing to always remember is that what's helpful or not helpful in someone's life will be individual. So there is no necessarily categorical sign that tells you that somebody is depressed and in a state where they absolutely need help, because everyone's life is different. But what you want to start noticing is patterns and changes. So the obvious one that we hear of a lot with depression is, loss of interest, apathy, fatigue. These kinds of things are common when someone is feeling depressed. And so there might be loss of interest in things that they used to like. So they used to really enjoy playing sport and now they don't want to anymore, those kinds of things. Just not caring as much about things that maybe they used to care about. And then feeling tired a lot of the time. Now, of course, fatigue and things like that could be related to other issues, but it's always good to keep in the back of your mind that if there is this sort of pattern of real elongated fatigue or just apathy, then that's something to pay attention to. And also keeping in mind that it's normal for all of us to go through a few days or an hour or a few weeks where we do feel just apathetic and tired, and that's okay. So we don't have to be really, really concerned if we see a little bit of that, but if it starts to become a pattern and you're noticing this is consistently now what's happening for this student, that's something that we want to think about. Because no matter who a student is, if they don't have an interest in things and if they're apathetic, there's going to be a layer of depression there. And sometimes we miss students because that's all we've ever seen of them. So we've only seen them in that kind of state. And so we sort of might think that's just how they are. But there's always going to be some sort of element of a depressed state if a student is not interested and not engaging in anything. It's okay if they don't like certain things, but if that's the way they are in all areas, then we want to pay attention to that. So any changes in behavior, in sleep, in eating, and that could be sleeping more, could be sleeping less, could be eating more, could be eating less, could be any kind of behavior change. But if you see sort of a sudden or dramatic change, or they're acting in just a really different way, and sometimes it's not what you'd think either. Sometimes they're really, really hyper and they're acting in a really sort of up manner. We would obviously notice a little bit more if a student is starting to get really, really low. But sometimes the behavior is sort of really risk-taking, which we'll talk about in a minute, or kind of really engaged with the world, but in a kind of hyper way, and it's different for them. We just want to pay attention. Again, not that we would diagnose someone for something like that, but we just want to notice, I wonder what's going on. And that's the most important question to always be asking, just being curious. I wonder what's happening that's causing them to have this change. Aggression and irritability, this is a big one. And again, this is a hard one because if a student or someone is aggressive or irritable, it's pretty hard not to take that personally. So often we will get caught up in the argument or the disagreement or how what they're saying or what if they're criticizing us or things like that. It doesn't feel very nice. And so this is a really important one to always remember. If somebody is being aggressive or being irritable all the time, there probably is some underlying depression or depressive state going on, because if we are angry and aggressive, we're usually not very happy. And so that's usually an element that's coming in there. Physical aches and pains. So a lot of kids, and this especially applies to younger kids, will have a hard time expressing their emotions or showing their emotions. And so sometimes it will come out as a physical ache or pain. And so we know this a lot about anxiety. You know, kids will get stomach aches and things like that when they're feeling really anxious. The same thing happens with depression. So there might be, you know, just any kind of physical pain that they're talking about. And in a lot of ways, it's a metaphor for what they're feeling. So again, just a good thing to keep in mind that sometimes physical challenges and physical pain are representing some of that emotional pain underneath. Risk taking, what I mentioned before. So doing things where there's an appearance of fearlessness can often show an underlying belief that, you know, I don't care about myself and that's why I'm taking these risks, or I don't really care about living, or I don't value my life or myself. And that's sometimes where that risk taking comes from. So it's always good to pay attention to that. And then people pleasing. And this is a really important one, because a lot of the things I've talked about before, you know, are things that you might have heard of, or you might have, you know, associated with depression. But a lot of the time, especially for kids, and this also applies to adults, but we are really conditioned to fit in, to get validation. And so sometimes when a child or even an adult is depressed, what you'll see is the opposite. So you'll see, you know, really pleasant interactions. You'll see positivity, sometimes a lot of positivity. You'll see, you know, always doing things for other people. You see some of this kind of behavior. And again, that's not to say that everyone that people pleases is depressed, because we all people please. But it is really important to recognize and understand that a lot of depression is very hidden. And so that people pleasing is really designed. The reason we do that when we're in a depressed state, if that's one of the things we do, is because we're trying to make those feelings go away. And so we're doing all the things that validate us and that make us sort of almost feel like we can pretend things are okay. And then those feelings just get pushed further and further down. And so for some kids, they people please all day at school and then they go home and they fall apart. For other kids, it's buried so deep that they actually never really fall apart and they're just people pleasing all the time. But that's almost the most scary, because that's when it starts to trickle over into things like self-harm and things like that, because those feelings have to go somewhere. And oftentimes it's the kids that internalize, and you don't see this outward behavior and everything seems fine. And actually there's a lot of internalizing going on. And that's where that sort of self-harm and suicidal thoughts often can come from. So that's kind of the picture in terms of the signs you might be seeing. So in terms of what are the causes? Obviously, we know trauma is a big cause of depression, so that could be past or present. So things that have gone on in their life that are hard, whether that's, you know, moves with their family, whether that's, you know, an accident, a loss in the family, or, you know, patterns of trauma that have occurred within their family. Again, it could be current, it could be past, but anytime there is a significant event or a situation that the child finds hard, that can lead to depressive tendencies. Another thing that often is linked in schools with depression are things like learning challenges. So if you are different from your peers in some way and things are harder for you than your peers, it is really, really hard for you to have a positive sense of self and to see the world in a positive way, because you start to think negatively about yourself. And that can really lead to feeling low. So a lot of times, this is why we talk about learning challenges often have mental health really closely linked. And one of the reasons is because it's so hard to feel good about yourself when you have a deficit based on what's happening around you and your peers, because there's such a focus on that age of fitting in. Friendship issues can also cause depressive states, especially if they're ongoing and consistent. So kids that really struggle to find friends or have lots of changes in their friends, the same thing can happen. They can start feeling really low and down on themselves and start to doubt themselves a lot. Family struggles as well is a common one. So if things are hard at home, there's that tendency to question yourself, to question your environment and your world, and that can be quite depressing. Biology, of course, is always a factor, but it's important to remember that this is a percentage. So there's never a depressive state that is entirely biological. There's always flavors of other things. So if there is depression running in your family, absolutely it's much more likely that you'd have those depressive states, but it has to get triggered by something. So there's always a factor in it, but it's never the whole story. So it's important to remember that if, for example, you're told that one of your students has depression and it's been diagnosed by a psychiatrist or something like that, always keep in your mind, okay, so there is some biology there, but also what's the context for this child? What things are hard for them? And remembering what's hard for everyone is going to be different. So what's very easy for one child might present a really traumatic experience for another child. So we always want to pay attention to what's happening around them that's also causing this. Intergenerational patterns, that's another really important one to look at. So for example, First Nations students or students that are in experiences where there's been generations of abuse or trauma, or if there's been, parents that have gone through significant traumas, and then generations after that, there's a ripple effect. Because those kids that grew up in that traumatic situation a long time ago start to develop probably depressive frameworks, and then they're raising their kids with those frameworks. And so that's how those things continue to get passed on. So it's really important to keep that in mind, that even if you look at a child and you see that their life right now is quite calm and peaceful, but looking through the history, that their parents really struggled or their grandparents really struggled, it's just helpful to keep that in the context. And then also cultural patterns and events. So what we noticed a lot of, and I'm sure you noticed with your students, is after going through COVID and those students that had to stay home and isolate if they weren't used to it, if there were sort of challenging things happening at home, this added to it. But even just the experience of having negativity and fear on the news all the time, things changing without them being able to control it, joyful things being taken away from them, all of that has really caused a lot of, especially teenagers, to feel quite hopeless and depressed about the future. And that's a little bit that loss of control. That's a trauma. That's something that happened that caused them to really doubt things. And so sometimes there are these sort of events that happen that really impact a whole subgroup of the population or a whole generation. So wars or things like that. And so we've just been through one. So it's really important to keep that context, that it's very normal for students to feel a little bit depressed after going through something like that. Doesn't mean that we can't help it, doesn't mean that every student is going to feel like that, but just knowing that it would be a common response, it would be a natural response to going through the kinds of things that they went through at their age. Okay, so now I just want to break it down a little bit more, because knowing all that is one thing, but what actually is it? What is depression? How does it manifest? This is a really important thing to kind of know on a bit more intimate level, because it can be a little bit overwhelming to think of something like depression as an educator. If you're not used to working with mental health in students, it can feel a little bit scary. So I want to just break it down so you really understand what exactly is happening when someone's in a depressive state, and where does it come from on sort of a personal level, so that you can kind of understand that process a little bit better and hopefully simplify it a little bit. So at the basic level, what happens is, for all of those reasons we just mentioned, we feel something hard. We feel a challenging feeling. And as we go through these, I'm going to give an example of myself just so you can actually also just understand it on that personal level. So, the time in my life where I was probably the most depressed, where I went through a bit of a depressive phase, for me, anxiety is much more common as a go-to response than depression. So, it's not something I felt a lot of in my life. I definitely people pleased a lot as a kid, so I did not feel depression at all, although I think it was probably underlying. But this one phase in my life, I definitely did have a bit of a depressive state. And so for me, it was the ending of a relationship. So that was the trauma, that was the event. And of course, there was lots of underlying early childhood stuff that I hadn't dealt with yet. But it was hard for me. It brought up a lot of feelings and a lot of challenging feelings. Now, the next layer of this is that in order to sort of get to a depressive state, we also have to have a lack of resources or skills to cope with it, because we all feel hard things all the time. But if we have the support, we have the skills to get through it, then we can navigate that and it doesn't have to turn into a depressive state. So kids and all of us really can go through really big challenges, and it can turn into a beautiful experience of resilience and growth. So hard things and trauma, they don't always have to be bad. So it's important to remember that. But if you don't have the resources or skills when that hard thing happens, that's when things start to go downhill. So for me at that point in my life, I had not been in consistent therapy before. I hadn't resolved some of my earlier challenges. And so I really didn't know how to deal with the feelings that were coming up. So that was in that sense. Now, what we do when things are too much for us is we start to try to avoid the feeling, because it's too much. And we know on some level that it's too much and it's overwhelming us. And so, for example, in that state for me, the way I avoided that was didn't talk about it with anyone. I pretended I was fine when I wasn't. It was when I was sort of in my 20s. So I was partying a lot and kind of just doing a lot of things that were a bit self-destructive and a bit just avoidant. And so with kids, they might do any of the things that we saw on that first slide. They might be getting aggressive. They might people please like I did. They might not want to talk about it. They might dump. That's another way we kind of avoid our feelings, is we just start blaming and dumping, and we're not actually connecting to the feeling. We're just kind of, there's just stuff coming out of our mouth about it all the time. But in some way, we're avoiding the experience of that feeling because it's too much. Now, when we avoid feelings, this is the tricky thing about feelings, is that you can't just avoid the hard ones. So if you're in a state of avoidance towards your own emotions, you're really in a state of avoidance towards yourself. And so you're disconnecting from all of your feelings. This is really what depression is. It's a state of numbness. It's not actually a state of sadness. It's more so a state of disconnection and numbness. And if you talk to anyone who's been in a depressed state, or if you've been in a depressed state, you know that flavor. It's like you're just not quite with yourself. And of course, there can be lots of feelings of sadness associated with it, but they get trapped because there is this kind of just hopelessness, numbness that starts to eventuate because we don't know how to feel them. So we're disconnecting, we're not feeling. And at that point, this is the part where it gets tricky. We don't then know why we feel that way. Because if we avoid feelings, they get kind of backed up. So we're pushing our feelings away. And then we have this sort of mess of feelings and we don't know where they're coming from. And so we start to wonder, why am I feeling like this? And so in my example, this big thing happened. I ended a relationship. It was very significant. But because I wasn't dealing with it head on, in the course of my daily life, when I was starting to feel low and disconnected, I actually didn't connect it to the experience of the separation because I wasn't thinking about it all the time. It had happened maybe a few weeks or months before that. So it wasn't something that was in my headspace, but I was feeling this way. And this is a really important thing to remember, because So many kids and so many of us as well, there's this big question of, why do I feel this way? I don't know where this is coming from. And a lot of the time, there is something. There's some challenge, whether it's a really recent one or a bigger one. And because we've not been able to feel it, we've disconnected from it, and then there's this state of confusion around it. So even this can happen with kids. They'll get into a disagreement with a friend, or a friend will say something mean to them, and they're not really able to process it at the time. And then even as soon as the next class or a couple hours later, they'll be feeling really sad, and they'll say, I don't know why I feel sad. And you can see, oh, this hard thing happened to you, and that's why you're sad about it. That makes perfect sense to me as an outsider. But in a child's mind, or even us as adults, even if the event was really recent, if we haven't processed it, our mind will kind of just cut off from it. So then we're in this state of, why am I feeling this way? And that's what leads to all those questions and doubts and criticism of self. And that's the depressive state. So we start to go, maybe there's something wrong with me. Maybe I'm not good enough. Maybe I need to change. All those depressive thoughts, or maybe there's no hope and there's nothing I can do. So that is sort of the cycle. And then when we're there, the next time something hard happens and we feel something hard, it gets even harder and harder to feel it, because we get more and more disconnected from that. So hopefully that helps just break it down in terms of what's actually happening that leads to this. And of course, there's layers to this and nuances, but just as a really sort of simple overview of the process that's going on in a person's mind when they get to that state of depression, is just helpful in terms of how we support someone in this state. Because if we understand how it happens, it becomes a lot more clear to understand, what can we do to help? So that's what we're going to jump into now. What can you do in this situation? So in terms of understanding what you can say and what you can do with a student or with someone who's struggling, it's important to know just in general, what changes things for someone in a depressed state? How do they come out of it? So the first thing is openness. So as we talked about, it's all about, we're pushing our feelings away and we're disconnected. So if we become more open to our feelings, to life in general, to things around us, that is massively helpful, because it just helps us reconnect. This requires a lot of courage. So remembering the whole core of what's happening is that we're feeling something that's too hard for us to feel. And that can be terrifying. And so it really requires a lot of courage to be able to face that, to be able to open up a little bit, whether it's opening up to our own feelings or to someone else. It requires an incredible amount of courage. And it takes practice. This is why it's so important to create situations in the classroom where you're practicing and you're having these conversations as much as possible. And obviously classrooms are tricky because there's lots of other stuff going on. So sometimes these conversations can only happen ad hoc, but any kind of specific training where you can sit down and work through this stuff. That's why we've built the resources the way we have, to give you that chance to practice. How can we practice being brave? How can we practice being open to the things that are hard? And it also requires us to be seen. And this is really important. So our pain needs to be seen and heard so that we feel validated in it, meaning we don't really know why we feel that way. So if someone can help us point out, oh, you're feeling sad because your friend just said something mean to you, all of a sudden we go, oh, and this weight is lifted. Oh, it's not because something is categorically wrong with me. There's a reason for this. And we also have to have someone else, usually. We can do this on our own, but it is very helpful if someone else shows us the possibility of how to get through it. So they need to see in us, I know you can get through this. I've seen your strength. I've seen you get through things in the past, because in that moment in a depressed state, we don't believe that ourselves. So we do actually need someone to do that for us. And these steps These are things over in my life. Once I got into regular therapy, this is where I got this experience. So of course, that's a therapist's job. They see you, they see your pain, they help you connect the dots, they see the possibility, you're practicing, and you're practicing courage, and you become more open. But the challenge is, how do we do this in a school setting? Because most kids will not end up going to therapy. And so we want to figure out, how can we just infuse these same skills and put this information in the hands of you as educators, because you have such power in all of your interactions with students to make such a big difference in just little ways. Again, of course, your role is not to be their therapist, but there's so many little things that you can do if you have this framework in mind of, okay, these are the skills I'm going to practice. I'm going to give you some language in a second in terms of how you promote this for them. Okay, so the first thing to start with is just, what are the helpful phrases? So there's a few things that we'll go over in terms of kind of what are helpful things to say, and then we're going to break it down into a few actual situations that you might encounter and apply the phrases to them so that you can really workshop this. And I really encourage you, especially if you're watching this recording or whenever you can, to get together and discuss your own examples. Try to apply this language to situations that you know you encounter in your classroom, so that you can really kind of get a feel for what this language is like. So one of the first things that's really important with this is just this piece of empathy, just to highlight, I'm so sorry you're struggling, just to identify it, and simple language like that. I'm sorry, this is hard. I'm sorry you're going through this. Just showing that empathy is so powerful, and we often underestimate how helpful that is for a student to hear us say that, because it indicates that we see them and we care about them, and that's a really important part of this. The next piece is phrases like, I believe in you, you're okay. This is helping them see that pathway through. And I just want to give a quick story here about why it's so important for us, as someone coming in outside supporting a young person or even an adult in a depressed state, why it's so important that we believe they can make it through. Because that is such an important element of this. If we believe it, they will start to believe it. And I want to give you just this quick story about this research that I stumbled across a number of years ago now, but it fascinates me. So they did this study with dentists, and it was dentists and their patients. And it was a study about pain medication and the impacts of pain medication. So bear with me because it's kind of hard to explain, but they had different groups. So some of the dentists knew they were giving pain medication and gave pain medication. Some of the dentists didn't know they were giving pain medication, but actually were. Some of the dentists knew they weren't getting pain medication and then they weren't giving it. And then some of them thought they weren't giving pain medication and they were giving pain medication. So this whole study was basically, what's the impact of what a dentist believes they're doing versus what they're actually doing? So how strong is the pain medication, and how strong is the impact of the dentist's belief in whether they're giving pain medication or not? And the thing that's phenomenal about this is that the pain that the patient reported, who never knew anything, they were completely blind in the whole thing. They didn't know it was, whether they just assumed their dentist was giving them something. The patients reported less pain when the dentist thought they were giving pain medication. That was more strong than when they were actually giving pain medication. And why I think that's so interesting and important for us all to remember is basically it points to this subtlety of human connection and communication that we are just light years behind really understanding. And so if we look at a child and we feel this sense of dread of they're not going to get through it, they're in this terrible state, and there's nothing that can be done, and I'm terrified for them, those are normal feelings to feel. But if we can remember to adjust our thinking And remember that whatever situation they're in, they will be okay because humans are incredibly resilient. And remember that they do have strength, that they do have power, no matter how scary or hard their situation is. And if we can believe that and feel that, the things we communicate subconsciously are very powerful. And so just keeping that in mind, that if we can just always have the framework, and if that's the only thing we do, is just remember to think when we're interacting with a student, think to ourselves, I know they can get through it, and then communicate that in whatever way that we can. That can have a huge ripple effect that we don't even know yet how much of an impact that can be. So that's a just important thing to keep in mind. They will be okay. Yes, they will need support. Yes, there will be times when it's extra hard for them. But if we keep believing in them, that's what helps them believe in themselves as well. Okay, pointing out specific times. This is how I've seen you be brave, being brave. So remembering courage, we don't often notice when we're being courageous. And usually when we're being courageous, it's very hard. So it doesn't feel very glamorous. When a student is setting a boundary for the first time, or when they're talking about their feelings for the first time, they're not going to feel like they're doing this great thing. They're going to feel probably pretty yucky about it because it's not pleasant. So we got to point that out to them. This is when I've seen you do this. I've witnessed this. Remind them. Now, this is important if you hear them. You can't really do this unless you know what their thought is. But oftentimes when we're in a depressed state, we have these really negative thoughts. So I'm not good enough. I have to be perfect. No one's going to like me. If you know what that thought is, or if they're communicating it, or if you can guess and they're open to having that conversation and you have time to have that conversation, you just want to, again, you're encouraging openness. So you're just opening the door. Do you think there might be a different interpretation? And so remembering, you don't have to change their mind. You don't have to tell them that that thought is wrong, because that usually can just feel a little bit dismissive. But if we're just, again, the curiosity, opening up, might there be a different interpretation? I really get that need to be perfect, or thinking like you have to be perfect, but do you think there's any other way we could look at it? Is there another solution here? What would happen if we didn't have to be perfect? Like, you're just opening up the doorway. Is there another way we could look at this that might not feel so low? And then the last piece, what can we do right now that might help? Now, I put might in bold here because if you're in a depressive state and someone comes along and says, we're going to do something and it's going to help, that sometimes doesn't feel that great, because when you're in a depressed state, nothing feels better. And that's okay. So we don't want to set an expectation of we are going to fix it and we're going to make it better. We're just saying, hey, let's try something that might help. And we have to take really small steps. And there's a term for this. It's just a fancy term for saying doing things that help us feel better, but it's called behavioral activation. And it's what psychologists use. And basically all it is getting kids or adults to write down a list. What are all the things that have made you feel better in the past? And they could be simple things like getting enough sleep, eating certain foods, talking to a friend, drawing a picture, whatever it is, exercising. And then actually making little targets of, okay, so the goal is you do one of these each day. And then once you get doing that, let's try now doing 2 of those each day. So little tiny baby steps, and it's not going to feel better right away, but you're helping them learn that we can actually improve our mood with our actions. But we have to identify what are the things that help us feel better and then practice using them. And so this is one of the ways where schools and educators are perfectly placed for this, in the sense that you are seeing kids every day. So this is something to just keep in your mind, because I know you don't have time to have a full conversation a lot of the times with students. Sometimes you might, and that's great. But just to know in the back of your mind, if I can just encourage kids to do something, just have that regularly encourage, hey, I noticed that one's feeling low. Why don't I just encourage them to do something active because I know they like that, or encourage them to get out and play with their friends or something. If we're just always reminding them, that really helps because we don't always remember this when we're in those states. Okay, so I want to just go through some examples of situations that you might find yourself in terms of working with your students. So I'm depressed, or I'm no good, or you might hear a student actually say something that indicates they're in a depressed state. That's one way you might find out about this. You might also get secondhand information. So a parent might tell you, the school counselor might tell you, or a psychologist might call you up and say, this child has gone through this. And it can be a bit tricky to be in that because it's sort of like, what do you do with that information? Well, I can't bring it up with them directly, but I know this about them. How can I navigate this? So we're going to talk about that. We're going to go through each of these individually in a second. You might notice that they're not motivated. So you see their behavior. You might notice that they're irritable, acting out, or risk-taking, or you might notice that they're people-pleasing. So I'm just going to quickly go through the phrases that I just used in each of these examples that you can apply them. And this is what I encourage you to do also with your own examples. So try to apply them to specific situations and see how they fit. So the first situation is if they actually are saying things or that indicate they're depressed. So they're verbalizing it to you. So this one is the sort of the cleanest in the sense that all the phrases make sense. So we always want to start with empathy. I'm really sorry this is hard. I believe in you. I know you're going to be okay. Pointing out, this is how I've seen you get through other hard things before. They're saying things so you can actually start saying, do you think there might be another interpretation? Is there another way we could look at this? Really help them identify what that thought is. If you think you're no good, do you think maybe there's any evidence to say anything otherwise? For example, what do you think I think about you? Just ways of opening their mind a little bit. And then what can we do right now that might help? What's a small thing we can do? So if a student is acutely struggling and they're upset, this is the general framework you want to take. Start with empathy, encourage them, help them open their mind a little bit, and then help them do something in that moment that is calming or soothing, and then just repeat that process. Now, if there's risk, the same process applies. So everything is exactly the same. The only difference, so risk meaning you're concerned for their safety, they say something that indicates they might hurt themselves or they might hurt someone else. The only difference is that instead of suggesting something that they do to help, you take them to a person that can help them right away. That's the only difference. So it can be really scary and overwhelming thinking that you might find yourself in a situation with a student who is saying a suicidal thought or anything like that. And just know that you absolutely have the skills to deal with it. It's just that empathy piece, letting them know you care, and then taking them to someone who can process it more fully with them. And also in that, making sure that you're taking care of yourself. So after this, if you're in a situation like this with a student, you also need these steps for yourself. So remembering that, if your colleague has been in a situation like this with a student, we can also have this response to them. And that's a really helpful and important way to think of it in a school context, that everyone that encounters this kind of a struggle is impacted. So we want to take the steps for all of us. So if we receive information, it's slightly different. So we are not going to actively say, I'm so sorry you're struggling, unless we were told, yes, please bring it up with that student. A lot of the times you might be told, this is what's happening, but don't bring it up with them directly. So you don't say that piece. You still say, I believe in you. So we don't reference, you're going to be okay. We don't, look at them with pity. We just reinforce, I believe in you. We give them this message. We can still give them that message, even if they haven't told us or we're not talking about the struggle directly. Point out their courage. Again, we can do that step, absolutely. So I put a question mark here for this one. If they say a negative thought, you have a conversation about the interpretation. If they don't, that's fine. You leave that. If they show you something that indicates they're upset or overwhelmed or struggling, then you help them, do an action that will help in that situation. If not, no problem. So if you know something about a student, all you need to focus on is giving them that message that you believe in them, that you pointing out situations where they've been courageous, and know that that's a really, really helpful and impactful thing to do. So there's not a lot we can do in this situation if we can't talk about it directly, but those things are very powerful. Okay, if they're not motivated, really important to identify for them to see, I see that you're struggling. So a lot of the times if a student isn't motivated, they might be met with frustration from adults, why aren't you doing your work? If we can identify, I get it, I get that this is a struggle for you, that really shifts it, that makes them feel really seen. I believe in you and you're okay, same thing applies, Notice that how they're courageous. If they say a thought, do the interpretation. Again, if they don't tell you what their negative thought is, we can't have that conversation, that's okay. So remember, also take the pressure off yourself that you have to have all of these conversations. You don't. These are just the tidbits to know, okay, if a student ever has a negative thought come up, I know I can sort of open the door to, is there another interpretation? But you don't need to force it. And then if a student is not motivated, you absolutely can encourage them. Okay, what's one little thing you can do? So this applies to schoolwork as well. What's the smallest piece of your homework that you could do? So just what's a little step we could take right now? Okay, now if they're acting out, risk-taking, irritable, same thing. We want to notice that is a struggle. So not coming at it from the perspective of you're doing the wrong thing and you need to stop. Even if you need to set a boundary, absolutely fine. But identifying, I get that you're doing this because you're struggling. They might not want to talk about that or accept that. That's okay. You just say it. I get it. It's hard. Same thing applies. And then the same thing. So we're always identifying, I know, I believe in you. I've seen you be brave. If they say a negative thought, you help them with the interpretation. If they're shut down and they don't want to, that's absolutely fine. And we also can still ask that question. What can we do right now that might help? So you've done this thing, you've acted out, I get it. What's one step we can take that brings us back into a place we want to be? So just same process, that empathy goes such a long way. And then finally, people pleasing. So same thing, we want to identify. I do see that this is hard. Help them name it. I believe in you, it's okay, same thing. I understand you, be brave. If there is a thought that they identify, help them with another interpretation. Do you have to help people all the time? Do you have to be perfect? What can we do right now that might help? So what's one way that you could maybe do something for yourself today? So we're just helping them break that down. Okay, so there's just a couple more things I want to say. I know them right up against the end for time, so I'll just go through this really briefly. In terms of behavioral activation, doing better to feel better, anything can apply. They don't have to be in these categories. These are some examples. Something that's movement oriented, fun, outside, causes connections, helps a student have mastery over something, so something they're good at, or new and novel. So these are just ideas of things. And consistency, so something that they're doing regularly, is very helpful. Now, just really quickly to finish, sometimes we need to leave a situation. So sometimes a situation is very hard and a student is depressed and we need to leave. So I've worked with students, for example, that feel like they need to leave a school, or you might have a student that feels like they need to change classes. Something's really hard and they want to get away from it. Or I can't be in that class because it's too hard for me. I need to just, so sometimes it's about the people, but sometimes it's about the schoolwork. That's fine. Sometimes we do need to get out of a situation that's really hard, but how it happens really matters. So I just want to really take you through this very briefly. It's really important that a student feels that they have agency and choice in it. So leaving something because it's so hard and overwhelming and I can't cope with it just leads to more depressive cycles. But leaving something that I know I can handle and I've worked with and I've tried, but in a situation of feeling calm and empowered, I make a choice to leave, that puts us on a totally different trajectory. So that's a really important thing to remember. So first, if a child wants to leave a situation or change things dramatically, remember, we want to first teach them the skills. Let's understand how we can cope with the feelings you're feeling. Then we can get that important learning. I can overcome challenges. And then if we still feel that way, we still feel like, you know what, I don't want to be here, then we can decide to leave at that point. Not that learning that I can't cope with hard things, so I have to avoid them. So just keep that in mind in terms of if there is a change that has to be made. So the steps then are, identify the challenge, what's hard, notice the impact of the challenge. Why is it hard? How's it impacting you? Address that impact. So soothe our feelings, change our thoughts, explain the process. So make it, we'll make a change when we're feeling calm and when we feel, and you can really explain that specifically. We don't want to change something when we're in a state of distress, because then we'll just feel like we're a failure. We don't want to feel like that. And you're not a failure. So let's calm down first. And then go through the pros and cons. What would be good and not so good about leaving? And then once you make the choice, check in, how did it go? Let's try this and let's see if that's the right thing to do. So just in terms of if there is a situation that really does need to change because a student is very depressed, this is how you want to go about doing that. You don't want to just pull a student out of a situation suddenly where they don't feel like they have agency and choice in it. Okay, I will stop sharing. Thank you so much. I know I pushed it right up into the edge, but if anyone has any questions, I'm happy to stay on for a little bit longer. And thank you so much for being a part of this.